Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Does Medicaid cover swimming lessons? It's a critical question for many families, especially considering that learning to swim is a vital life-saving skill. The simple answer is that, in most cases, standard Medicaid does not cover swimming lessons. This is because Medicaid is a health insurance program designed to pay for services that are considered medically necessary. Generally, state Medicaid agencies classify swimming lessons as an educational or recreational activity, not a medical treatment. So, if you're just looking to sign your child up for basic water safety classes at the local pool, Medicaid is unlikely to pay for it directly. However, the situation is more nuanced, and there are some important exceptions where coverage might be possible, so don't stop looking just yet. The most significant exception falls under a federal benefit for children called the Early and Periodic Screening, Diagnostic, and Treatment, or EPSDT, program. This benefit applies to all Medicaid recipients under the age of 21. Under EPSDT, states are required to cover any medically necessary service, even if that service isn't covered for the adult Medicaid population. This is where swimming lessons could potentially be covered, but there's a catch. For the lessons to be approved, a doctor or another licensed clinician must prescribe them as a specific treatment for a child's diagnosed physical, developmental, or behavioral condition. For example, a doctor might prescribe aquatic therapy or swimming lessons for a child with a physical disability as a form of physical therapy, or for a child with autism spectrum disorder to help with sensory integration and motor skills. In this scenario, the lessons are not for general water safety but are a targeted medical therapy. Another potential pathway is through Medicaid Home and Community-Based Services, or HCBS, waivers. These are special state-specific programs that allow individuals with significant disabilities or chronic conditions to receive care in their homes and communities instead of institutions. Some of these waiver programs may include funding for services like recreational therapy or community integration, and in some very specific cases, swimming lessons could be approved as part of an individual's care plan. This varies tremendously from state to state and waiver to waiver. Finally, if your Medicaid is delivered through a private managed care organization, or MCO, you might have another option. These insurance companies sometimes offer extra value-added benefits to their members that go beyond what standard Medicaid covers. It's possible an MCO might offer discounts, reimbursements, or free passes for programs like swimming lessons as a wellness incentive. So, what should you do? First, contact your state's Medicaid office or the member services number on your insurance card and ask directly. Second, if your child has a specific medical condition, talk to their doctor about whether swimming could be considered a medically necessary therapy and if they would be willing to write a prescription for it. It's not a guarantee, but it is the most likely path to getting it covered. I hope this explanation helps you navigate this complicated topic. Thank you so much for watching. If you found this video helpful, please hit the like button and consider subscribing to the channel for more clear and simple answers to your questions.